foods that I put foods to avoid, but I don't really mean foods to avoid, but foods to be very careful with. Because if they're foods you enjoy eating, then I think you should carry on eating them, but be very, very careful. Things like minestrone soup can be dreadful because you've got very thin liquids and you've got bits of pasta and you've got bits of meat and you've got bits of vegetables. So that's very difficult. Stringy foods, salads are very difficult. Bacon can be very difficult. Salads like celery can be difficult. Fresh bread, brown bread's usually easier because white bread just forms a doughy mass. Raisins, nuts, flaky pastry, spicy things like curries, foods with skins on like tomatoes and apples. And the foods that people usually find easiest to eat are the softer foods. Chicken is usually easier than steak. Soft tinned fruit, pasta, cream soups as opposed to the minestrone, jellies, custard. Desserts are usually easier, fish in a sauce. They're just a selection of things which people usually find easier to manage. Everybody in this room with mitochondrial disease will be on medication. And they, again, can be quite difficult to get down, and it can be a nightmare. Capsules are easier to swallow than tablets. Medication may be available in soluble form. Things like aspirin, you can take soluble aspirin. And if you are allowed to crush tablets, not all tablets can be crushed, then they can be taken in something that you feel very comfortable eating. And I put up examples there of jam or yogurt. And medication may be available in liquid form. So it's always worth asking one of the doctors if you're having difficulty. Sometimes little pills are more difficult than bigger ones, to see if they can be changed. I'm always going on about oral hygiene because oral hygiene is something that is very important, and mouth infections can be avoided. It's usually caused by debris of food in the mouth, particularly with people, which sometimes happens in mitochondrial disease. You get facial weakness, and foods may pocket down the sides of the mouth, and that can cause the infections. So the answer to that is make sure that you clean your teeth after every meal and take a mouthwash if necessary. Now, if a person really is struggling to eat, and it doesn't happen with very many people, but if you are taking up to an hour to complete a meal and it's no longer enjoyable, or if you're just not able to eat enough, then it might be advisable to consider having a PEG, which is a percutaneous endoscopic gastrostomy. And that is just a tube which is placed by the gastroenterologist under sedation, doesn't need general anaesthetic. You have a little tube in your stomach, and through the tube, it may just be to supplement eating and drinking. So if you have a day when you're very tired and it's just you can't manage to eat enough food, then you may just supplement it by having a feed through your PEG. It may just be for medication or for liquids, whichever you have great difficulty with. But the patient has to agree with the procedure. So even if we think that you might benefit from a PEG, it has to be your decision, because some people would rather go on struggling eating by mouth. So it isn't for everybody. And a PEG, that's a PEG in place. When a PEG's first put in, you actually have a tube. But after about 6 weeks, you go back to the PEG clinic and you just have a little button placed. So it's very discreet and obviously doesn't show through your clothing. I put up the word fatigue because it's already been mentioned by Dr. Schaefer, and I'm sure it'll be mentioned again this afternoon. Everybody with mitochondrial problems seems to have a problem with fatigue. And if you find your speech is particularly bad at the end of the day, it's probably because you're tired. If you're struggling with a meal halfway through the meal, it's probably because you're tired, and perhaps it'd be better if you had smaller, more frequent meals. But it is just a problem, but it is something that you can overcome. I said at the beginning, was I a frustrated actress? Well, actually, I make a pretty good old tramp, smelly old tramp, and that was me before me earlier this year. Thank you very much indeed.
Thank you very much, Sue. I did discuss with Sue about the fact that she does a lot of acting, and I said, was she more nervous today than when she acts? And she said she was more nervous today because when you act somebody else, right, rather than yourself. So thank you very much. It was very clear, which is why I think it was excellent. So one of the things that I think is really important, and I think having Sue in the clinic's been a real bonus, is actually sometimes swallowing can be quite dangerous, can't it? I mean, the complications in terms of the infections is really quite an issue, isn't it?
Yes, as that video showed, it is very easy, particularly if you're eating the wrong consistencies, for food to go down the wrong way. And people who have chest infection after chest infection, those are the people that may need to consider having a PEG, because it really isn't safe to eat. Sometimes not eat anything at all, but usually you need a PEG perhaps to supplement the consistencies which are difficult to eat, and they're going down the wrong way.
Okay, and the other thing is, Sue, is that quite a lot of people you can help by relatively simple means. I mean, say, yeah. It's very, obviously, going, for people who have real problems, but often it's just simple advice, isn't it?
It's often simple advice telling people just to adapt their diet, take smaller meals, smaller mouthfuls, and perhaps altering their head position. If you tip your chin down as you go to swallow, it helps to protect the airway. There are lots of little things which can help, which is usually satisfactory with most people. And adding supplements, if they're not having enough oral diet, then on that particular day they may take a little supplementary drink to make sure that they don't lose weight, because losing weight is something we really do need to avoid.
Okay. And the other thing is, Sue, this thing that you can often give people advice in clinic, but if people need follow-up, I mean, there's speech and language therapists in all centres.
Yes, so quite often I will refer people on to a local therapist, and they will see them for advice at intervals.
Yeah.
Yes. And
then they might get back to you and things
yes.
like this. So again, Sue's often the one that is the one that has had most experience of patients with mitochondrial problems. So we will get it consulted back. So there are specific things that can be done to help. Okay. Anybody got any? I mean, perhaps what we should do, just because of timing, we might just ask Dr. McFarlane to come up. And what I would suggest is, if you have any specific questions about your speech and language aspect of things, please do catch Sue at the tea break.
I'm around for the rest of the afternoon, and I have got some leaflets on the table.
Okay, thank you very much, Sue.